Marshall.
Thank you, Chairman. Welcome, Dr. Ross, Lisa, family. Thanks for being here to support your husband and your dad. It means a lot to us.
I'm glad they're still here.
Yeah, they're still here. So welcome, Dr. Oz. Just kind of a big picture question. Why did you go into medicine, and what are some of the highlights or the most rewarding parts of your career?
I don't think there's a joy greater than looking a patient in the eyes and recognizing, both of you, that you're there for each other, that nothing will get in the way of you providing the best care possible. It's not that there won't ever be problems, but you'll be there emotionally supporting them. And if you've been gifted with teachers, as I was, that could educate me about how to take care of patients, you get to watch them get better and feel a joy inside your heart that can't be matched. I don't believe in another field. That's why my son Oliver, this one over here, is going into medicine. I think it's why I went into medicine, because I saw my father go into the hospital and do things like putting needles in people, which that looks painful, but the patients would smile and thank him for it, paradoxically. And that's why I think it's also appropriate for physicians, as you have, and other physicians on this committee, Dr. Cassidy, to enter government, because we're trained to tell people things that they need to hear, but aren't pleasant. Yeah. But that's how you get the system to work better.
Thank you. You know, everyone's giving you advice up here. I get to give you one piece of advice. You need more nurses at CMS. Nurses solve problems. They understand where the patients are, so encourage you to more nurses. But beyond that, my grandma always said, if you have your health, you have everything. And America doesn't have her health right now. 60% of us have a chronic disease. Several people pointed out this country is spending multiples more than other countries do to take care of our sick. There's not enough sick care out there to save Medicare and Medicaid. You and I came here to save Medicare and Medicaid, but part of that is making America healthy again, so that we don't have to do as many heart bypasses and give as much insulin and diabetic type of drugs. What is your prescription for America? How do you work with Medicare and Medicaid patients to help America become healthy again?
If I ask beneficiaries about Medicare, most people don't really know much about what we could do for them. They know about the payment issues, but they don't appreciate that the incentives around the payments drive a lot of the decisions. You know that because in your practice you saw that firsthand. But it is remarkable outside of medicine how it looks like an opaque box. If we incentivize wise moves by patients and their providers, their doctors, nurses, and I agree with you, the acting administrator of CMS is a nurse. So it's in capable hands if something happens to me. But the deeper promise that we should all be making to America is we're going to make it easy for America to do the right thing when it comes to their health. Yeah. Some of these decisions are not difficult. Some of them need to be simplified, and some of them need to be reminded frequently. And Senator Wyden and I had spoken about this a little bit, the idea of giving incentives to patients is an idea that I think is a worthy one, especially for Medicaid beneficiaries. If people don't feel like it matters what they do, if they don't think they have agency over their future, that they're getting up in the morning doesn't really make the world a better place, then yeah, they're not going to take proactive steps to reduce their diabetes or another action that would dramatically reduce their life expectancy and their cost to the healthcare system. Yep. So I think there's a lot of opportunity for us to do this, and we should be innovative and explore ideas. And I think there's an ecosystem we can build together to engender that kind of enthusiasm from people on the outside of medicine who want to make it better. We have got to challenge the incumbents in the system to have new ideas bubble to the top so we can pick the winners based on competition.
Yeah, we're not going to save Medicare and Medicaid unless we make America healthy again. Yeah. I'm going to talk just a second about maternal care. Came to this body, the other side of the Capitol, and people were talking about maternal mortality then. We were seeing a big spike in it, and I asked people why, what, how come, and we didn't have an answer, so thanks to my A+ staff, we funded a study. And not surprising to me, the #1 killer of women, pregnant women delivered that year after is actually suicide and fentanyl poisoning overdose. We don't need to study it more. We need action. Access Early access to prenatal care would be the other action point as well. So look forward to continuing to work. Half the patients I delivered were Medicaid patients. They need access to care, and we also need to stop the flow of fentanyl. My last question, though, speak briefly how price tags and healthcare savings accounts turn patients into consumers again, and how that might actually help save Medicare and Medicaid.
Senator, I appreciate your leadership in the Make America Healthy Again movement, both in the Senate but also outside of the Senate, being an advocate for it years before it was in vogue. There's a lot we can do with health savings accounts. We could even investigate new ways of using them. Maybe they should be part of your estate and passed on to your children, because so many families don't really have anything to pass on, and it would incentivize behaviors even at the end of life. But I think there's an opportunity for us to give consumerism, give the power of the purse back to the American people, especially if they're beneficiaries on Medicare, and let them make the wisest decisions they can. They got to that age by making some good decisions. And so we might as well let them keep going.
Yeah, here we go. Thank you. I yield back.